Today we are going to talk about Medicaid expansion in the state of Kansas, why we need it, and we are going to hear from our representatives and local healthcare providers and experts. I need to mention a few announcements. Don't forget that next weekend we will have our reorganization meeting for Congressional District Number 1. That's in Hutchinson, Kansas. And we still need a few more delegates because y'all voted so much last year that we get to name a total of 42 delegates to that organizing committee from the Lawrence area. So we still need a few more. There is potentially a bus, but definitely a van that is going to go down to Hutchinson. So if you'd like to hitch a ride, that might be possible. But we're really excited to just meet our other Kansas Democrats in our new congressional district, and we look forward to that. And then the following, the first happy hour, that's right, for February happy hour will actually be February 6th, and that's going to be at the Basil Leaf Cafe, 5:30 to 7. And then at the end of February, we will have our February seminar on the third Saturday, and then Washington Days. This year is going to be in February, so that is the State General Committee meeting, our reorganization of our caucuses, and all kinds of interesting things are going to happen, including we'll pick a new party chair. It will be wild. They are actually going to bring back the hospitality rooms, but maybe not quite as wild as they used to be. On Friday evening at Washington Days, Douglas County, Franklin County, and Jefferson County together, we're going to have a root beer float table. And so if you are at Washington Days on Friday, please stop by and say hi, have a root beer float with us, and then you can go drink the liquor that the Teamsters brought if you'd like. So now I was asked to do work today, and so I'm going to turn this over to David, and do you want all the panelists to come up and join you now? Okay. I'm going to hand it over to David, so. Oh, I lied. David, right, David Berkowitz has an appeal for money, and I'm going to make an extra appeal for money. It did turn out, through no fault of former leadership, but we didn't quite get an invoice from the Lawrence Arts Center last year, and so we just got our bill from last year, so we had to take care of that. So we do ask you to open your wallets. Our bookkeeper and treasurer both ask that if you are going to donate more than $10 in cash, that you make a note about who that comes from to help us keep our paperwork on the right path. And then we also provided QR codes today inside of these boxes on some little cards, because if you could consider becoming a recurring donor or do it digitally, it sure makes Josh and Jenny's job a whole lot easier, and we appreciate that.
Okay.
And I forgot the hats.
Well, actually, she's not telling you the whole story. We are so much in need of money that we sold the hats, and we're going to use the box today. And I'm very happy to be here. You know, things change. It's a new year. We have new leadership. But somehow you're still stuck with me asking for money. So we obviously need money in order to keep our headquarters going full time, in order to be ready to help Democrats who are going to run on local nonpartisan elections, and of course for the big election in 2024, where we're not only going to have all our representatives and Senate seats, but also the entire courthouse except for Patrick Kelly, which will include 4 county commissioners, the sheriff, district attorney, treasurer, county clerk, and register of deeds. So we have a big tasks ahead of us, and I would ask you to be generous today and be generous later. And of course, remember, if you can't put anything in, except you may make change. There you go, David.
Okay. We have all of our panelists here today except one, but I think she'll show up, and fortunately, she's the last speaker. So thank you all for coming. I know it's a small turnout, but these are the die-hard Democrats, right? Okay, good. So I was kind of joking with Becky Plate today. She and I, this summer, were invited to speak at a press conference up in Brown County before the Holton Community Hospital, which was shuttered. And we spoke to two people there. One was the reporter and one was the camera person. So we're kind of used to these small turnouts. This is actually good, yeah, because this is great. This is great. And that's good. And so people will be able to look at this now and later. So again, good morning and welcome. My name is David Gehring, and I'm a retired physician from LMH Health. I also volunteered for several years as a medical director at Healthcare Access Clinic, which, with the generous support from LMH Health, was dedicated to the mission of providing health services to uninsured residents of Douglas County. As we know, Healthcare Access Clinic was merged with Heartland Community Health Center in 2018, which continues the duty of serving our uninsured and underinsured citizens. Today you will hear from spokespersons from both LMH Health and from Heartland about the continuing need of health services for underserved people in our community. So in order to define the issues of our discussion today, I want to provide a brief overview. A provision in the Affordable Care Act, which was enacted in March 2010, called for the expansion of Medicaid eligibility nationwide in order to cover more people who were uninsured. Under the ACA expansion guidelines, Medicaid eligibility was extended to adults under the age of 65 with incomes up to 138% of the federal poverty level, which for a household of 3 persons is currently $34,300. Now, to be clear, currently in Kansas, the income limit for an adult with 2 children to qualify is about $8,750, which is only 35% of the federal poverty level. So in June of 2012, the United States Supreme Court ruled that states could not be forced to expand their Medicaid programs, so it was left to each state to determine whether to participate or not. Initially, only 26 states expanded Medicaid when it first took effect in 2014. But since then, more states have recognized the value of expansion, not only for their citizens, but also for their state budgets, their economies, and the vitality of their smaller rural hospitals. Sorry, what? I thought somebody said something. Okay. Currently, Kansas is one of only 11 states that have not expanded Medicaid. We are literally surrounded by states which have introduced expansion. So will we be the last? So this morning I am pleased to introduce our panel of distinguished guests who will speak from their perspectives about the critical need for expansion of Medicaid, which is also known as CanCare in the state of Kansas. April Holman, who is in absentia, but will come here, I hope. She is the executive director of the Alliance for Healthy Kansas, which was founded in 2016 to advocate for CanCare expansion, and is now affiliated with dozens of health-related groups and agencies throughout the state. Representative Christina Haswood is a member of the Kansas House Committee on Health and Human Services. She will explain the past and current obstacles to Medicaid expansion in the Kansas legislature, a history which is fraught with political bias, arguments, and obstruction. Michelle Michelle Vanoni is the Senior Director of Finance at LMH Health. Lawrence Memorial Hospital is our community medical center, which provides millions of dollars of charity care for patients who are uninsured and do not qualify for Medicaid. Julie Brandstrom is the Chief Executive Officer for Heartland Community Health Center, which is a federally qualified health center and serves uninsured patients as well as those with Medicaid, Medicare, and private insurance. Melinda Levon is our newly elected chair, but is here today representing healthcare providers who may or may not accept patients regardless of insurance status. She has been a certified professional midwife since 2019. And our first speaker today is Becky Plate, who is a registered nurse and manager of a local urgent care center. She previously worked at LMH Emergency Department and in family practice. Becky's perspective as a provider as well as a patient with significant financial issues due to lack of health insurance illustrates the crisis faced by thousands of Kansans, and which is why we're here today. Thank you, Becky.
Hello. I just want to start out by saying that Medicaid expansion is the best way to help reduce the burden of medical debt here in Kansas and to help our communities be healthy, strong, and productive. My name is Becky Plate. I'm a registered nurse. I've worked in family practice, the emergency room where I met Dr. Gehring when he was working in the hospital there too, and currently manage an urgent care center here in Lawrence. I really believe that everyone should have access to quality, affordable health care, and that is part of what got me into the healthcare profession. I also know what it's like to be uninsured. Several years ago, just before the Affordable Care Act, I was a divorced mother with 2 small children. I was working part-time while going to school full-time, and so was ineligible for health care coverage through my employer and was too old to be covered by my family. And so I tried to apply for Kansas Medicaid. Under the program at that time, I was not eligible. Even as a very low-wage earner with dependents, I still made too much money. I didn't qualify for Medicaid health coverage, which left me with 3 choices at that time. I could quit working in order to fall further into poverty so that I could qualify for Medicaid. I could quit school to work full-time and remain in a dead-end, low-wage job just to qualify for health insurance through my employer. Or I could take a risk and go without health insurance while I worked towards my nursing degree. So I chose option 3, and I was fairly healthy and fairly lucky during that time without health insurance, but that luck did run out one night. I went to the ER when I woke up with sudden and severe chest pain. Now, fortunately, it turned out to be nothing serious. It was a quick visit and all was well. But it took me 2 years to fully pay off that 20 minutes of emergency care. So flash forward to today, and the Affordable Care Act offers expanded Medicaid coverage to the working poor, making my scenario something that should be completely a thing of the past here. More than $6 billion, with a B, Kansas dollars have been lost while we wait for expansion here. And yet here we are, still now, 150,000 of our fellow Kansans have been left behind. And still now, I see the same thing every day at work. We see uninsured or underinsured Kansans who only come to the doctor when things get really bad. We see manageable problems or illnesses that just are not being managed because of lack of insurance. And people are forced to utilize the emergency room when those preventable, manageable problems just become unmanageable. And uncompensated care leads to the closure of critical access care centers and increased healthcare costs for all of us. Expanding healthcare access to those who need it is a net positive for all Kansans. It helps keep our communities healthy and prevents manageable illnesses from turning into permanent disabilities. We could be making sure our folks are able to continue participating in the workforce, volunteering in their communities, and getting to live long, productive, and rewarding lives. And I would say today that the time to expand Medicaid in Kansas is now, but that's not really true. The truth is that we should have expanded it many years ago.
Thank you for sharing all that. I'm so glad you mentioned medical debt. That's something I forget about too, you know, and how that impacts people's lives for years and years to come, your ability to buy a car or house or anything else. I became a healthcare provider. Well, I was a nurse first a long time ago. I was a scientist, and then I missed clinical care, and so I retrained as a midwife. And part of the reason why I did that is because people just were not accessing prenatal care and STD testing and all these things that seem so difficult to get. And we're so lucky here in Lawrence and Douglas County to have LMH, to have Heartland Clinic, to have multiple doctor's offices. My biggest concern about our lack of Medicaid expansion is what that has done to our healthcare infrastructure overall. Because I have an office here, one in Wichita and one in Chanute, Kansas. And down in the Chanute area, there's just almost nothing left, right? Fort Scott's entire hospital closed, and they knocked down stuff. They're not looking for another hospital, right? They're not gonna have another hospital. Iola quit delivering babies. Garnett, Anderson County did quite a while ago, but now last December, they closed their entire maternity clinic. You can't even get your baby's heartbeat checked hardly anymore now in Garnett. You know, the obstetricians in Coffeyville, Kansas are 73 years old, and they're lovely, but they are going to retire, and I don't know how we're gonna recruit 2 obstetricians to come down to Coffeyville. Moran, Kansas lost their only healthcare clinic, so you can't get your blood pressure checked or get a refill on anything in Moran. So those are some of the bigger fallout pieces that I think people aren't always connecting, is that we, you know, when facilities can't stay open or we can't pay providers or recruit providers to parts of the state, then there's just not going to be any health care. So it's getting to the point where in some parts of the state, it doesn't matter if you have the CanCare card or not, if there's no doctor or hospital to help you. And that is something we need to keep thinking about when it comes to the Medicaid expansion piece, is how it destroys our infrastructure overall. Christina, are you going to talk a little bit about how bills actually get passed? Can you talk about that? Okay, we'll have our expert talk about that part. But you know, the process of getting legislation passed and the current people that are in power, I don't even understand their financial angle on it, actually. Because like you said, over $6 billion of Kansas money went to other states because we didn't expand CanCare. And $6 billion is a lot of money to me, so I'm really worried about the data that indicates that 1 in 5 Kansas physicians and maybe 2 out of 5 nurses are planning on leaving the profession in the next 1 to 2 years. I have 2 friends that just graduated through nursing school, so yay for going to nursing school in a pandemic with eyes wide open. But I'm very concerned about our ability to retain healthcare workers. You know, like I mentioned, some folks are going to retire, but other people have gotten really burned out during the pandemic. It's been exhausting, talking to friends and neighbors about masks and vaccines all the time and things like that, and conflict within the workplace even over those issues by some fellow providers. So our ability to retain the workers themselves is has really been harmed by not expanding CanCare. And I will continue to talk about maternal mortality. Y'all know how I feel about abortion. Abortion is healthcare, and healthcare is for everybody. I would like to see single-payer system, healthcare actually for everyone, and I see CanCare expansion as just one next step that we need to achieve so that we can get there.
Good morning. My name is Julie Brandstrom. I'm the CEO at Heartland Community Health Center. I've just wrapped up my first year in that role. So relatively new to Heartland, but not new to public health in our community. Some of you may know that I spent 15 years prior to coming over to Heartland as the executive director at the Douglas County Dental Clinic here in Lawrence, which was a safety net clinic that served low-income and uninsured members of our community with comprehensive dental care. And I came over to Heartland through a merger between the dental clinic and Heartland in the middle of the pandemic in 2020. So I'm privileged to be here representing Heartland, and am thankful to have the opportunity today to just talk a little bit more about Medicaid expansion and what that would mean to Heartland and to Heartland's patients. As my colleagues have already expressed, expanding Medicaid is a practical and cost-effective way to help healthcare consumers, providers, and the community by closing the gap in coverage for individuals that don't make enough money to afford quality healthcare insurance, but they have incomes that are too low to qualify for CanCare. Most of these individuals, I think, are employed, many of them working multiple jobs to make enough money to support their families. And additionally, expansion would strengthen the healthcare system and the economy overall by reducing uncompensated care costs and bringing federal dollars into the Kansas economy, which is so important, as others have already said. Medicare expansion would significantly increase Heartland's ability to provide care to our community, because Medicaid is actually an economic driver for federally qualified health centers like Heartland. FQHCs are unique in their reimbursement model, in that instead of receiving fee-for-service reimbursement through Medicaid, we receive an enhanced reimbursement rate, and it's a flat reimbursement for each Medicaid encounter that happens at the health center. So to help illustrate the specific impact that expansion would have for a health center like Heartland, in 2022, Heartland provided services to 20,358 unique patients through 64,520 encounters. 2,624 of Heartland's patients are currently uninsured. And Heartland, thankfully, does provide reduced fee health care to patients who qualify, and that would be people who are living at or below 200% of the federal poverty level, and we do that through a sliding scale according to household income. The majority of Heartland's uninsured patients are folks who qualify for services at our lowest fee level, which is $25 for an appointment for a medical visit or a psychiatry visit, and $10 for a behavioral health appointment. In 2021, Heartland provided more than $1.9 million in uncompensated care. That's a big number. If the health center was able to bill Medicaid for many of these visits that we currently are providing at a reduced fee, many of these services would receive the Medicaid enhanced encounter rate, and this would drive revenue to the health center that would be invested in additional workforce and other critical services that would benefit our community as a whole. Just to wrap up, I brought with me some copies of Heartland's annual report, which are informative, and you're welcome to take one today. But for those of you that don't know just a little bit more about Heartland, we provide primary care, dental care, and behavioral health psychiatry. We have an integrated care model. We strongly believe that it's really important to take care of a patient's needs, all of them comprehensively under one roof. And so we have integrated care teams that work collaboratively together to take care of the whole patient and all of their needs. And we've recently, in the last 3 years, have literally doubled in size through a host of acquisitions and mergers, first with healthcare access, like Dr. Gearing mentioned back in 2018, then the dental clinic, and a short 4 months later, Heartland acquired Panda Pediatrics, which is the largest pediatric practice in our community and has been here for more than 30 years, serving our community's kids. And so we've expanded greatly and are really grateful to have the designation of being a federally qualified health center, because that brings federal resources to this community and to the tune of more than $2 million a year to help us do what we do. Our mission is to welcome all who need care, and we strongly believe that Medicaid expansion would help us do more of that. Thank you.
So I'm Michelle Vanoni, and I'm the Senior Director of Revenue Cycle for LMH Health, and I came from a for-profit organization about 2 years ago, so happy to be able to be in a more community-centered position. One of the things I want to just remind everybody, LMH Health was founded over 100 years ago with the commitment that no person shall be excluded on account of race or physical, social, or financial condition to health care. And just to show LMH's commitment to that, in 2021, LMH provided over $34 million in financial assistance and charitable care to our community. And this had a really profound impact on our bottom line. However, it speaks to our commitment to financial stewardship and our commitment to high-quality care for our community. As the largest safety net provider in the community, LMH offers high-quality, innovative health care for everyone, regardless of their ability to pay. And we have been fortunate to partner with other community members like Heartland Health, Catch a Break for cancer care, Just Food for those people who are dealing with food insecurities, to help our communities in ways just beyond the doors of our building. One of the North Stars for LMH is that everyone has an opportunity to efficient health care, and that we're working to remove all those barriers, housing, education, poverty. What we believe improved health equity and access to care necessitates the expansion of Medicaid. In Douglas County, 40% of eligible adults and 48% of eligible children would benefit from expansion. Across Kansas, as already mentioned, 150,000 people would gain coverage with expansion. According to the Kansas Hospital Association and the Alliance for a Healthy Kansas, an overwhelming majority of Kansans support Medicaid coverage, 8 out of 10 voters. Allowing low-income individuals to obtain health care coverage through Medicaid expansion helps maintain our local coverage. As we spoke about all the facilities that have closed, there are so many that are on the brink of financial failure. Reimbursement from insurance often falls well below the cost of actual care. Insurance companies continue to seek ways to reduce the reimbursement levels and pass that cost sharing off to patients. And even while our health systems work hard to provide low-cost alternatives, LMH provides, besides financial assistance to our patients, For those individuals who are uninsured who do not qualify for Medicaid, we provide an uninsured discount both at the clinics and in the hospital themselves. Our foundation provides financial supports through help and healing funds and other charitable gifts. The expansion of Medicaid would alleviate a lot of those costs and allow us to provide services for other individuals.
Good morning. I am Representative Christina Haswood. I got elected in 2020, so I'm still really trying to grasp the in-depths of Medicaid expansion and the history of it. There's a great Reflector article that I'm referencing off of the past of Medicaid expansion. So I will start from that, from 2017. So both chambers passed Medicaid expansion, but unfortunately, Brownback vetoed it. In 2019, the House passed Medicaid expansion via gut and go, which means that they took one bill that has some sort of relevancy from the Health Committee, which was the APRN bill, and they put in the contents of Medicaid expansion into it, and that ended up passing in the House, but failed in the Senate. And in 2020, there was actually a bipartisan deal for Medicaid expansion, but failed at the hands of the Senate Republicans. They wanted to add in to take away abortion rights, and that's how all that kind of snowballed into the abortion amendment that happened on August 2nd, which we were very loud and clear that we want to keep our abortion rights here in Kansas. And, unfortunately, we had a couple bills introduced already to more attempts for that. So we already knew that was coming. And, with that, in the legislature, the political makeup is quite important because, unfortunately, Medicaid expansion has become a political polarization. Medicaid expansion is a Democratic thing, and being Republican, you have to be against it, which is quite unfortunate because this is all political games is being suffered at the hands of folks who really need health care, and it's impacting our whole healthcare system, and we can look beyond that to our housing and whatnot. So after that, it's quite difficult to come in with bills that are unfortunately going to die and sit in committee without the communication and cooperation of the other side of the aisle. So in the House where I serve, there's 40 Democrats and the rest are Republicans. And on the Senate side, I believe there's 11 Dems and the other are Republicans. So we have a super majority by Republicans. So it's quite funny when they say Democrats are blocking X, Y, and Z because they don't need our votes. But we do have a Democratic governor who will often veto a lot of this bad legislation. So it's quite interesting. And we always look for opportunities to add in Medicaid expansion on the floor, any ways we can kind of sneak it in. But this year is quite different because we have new leadership on the House side, and topics like medical cannabis, medical marijuana, has a different set of attitude than when we addressed this in the previous session. So it's a different tone in the House side, and then we know on the Senate side, I call it the dark side. If you've ever been there, they're quite uncooperative, to be putting it lightly. But I will say, I'm not exactly too sure if anyone said the date. One of the big main concerns that we're hearing is during the pandemic, through federal legislation, you could not kick people off of Medicaid, and we are anticipating that to end this year. I can't exactly remember the exact date or if there is a date set, but we are hearing presentations from our state agencies and departments, from our hospitals, from our community care networks and all that, that this is going to be a devastating impact for care for folks. And In looking into ballot initiatives, so this is something I'm not too familiar on, so if anyone wants to grab coffee or email me to educate me more, but on my quick research, Kansas does not have a statewide process to do ballot initiatives in comparison to other states. And looking at Missouri, when they did pass Medicaid expansion, initially the legislature was not required to fund it. So there was an issue there, but it sounds like 3 folks ended up suing the state who would fall in the Medicaid expansion, and the courts forced the legislature to fund Medicaid expansion. So that was quite interesting. Looking into more of the budget, so every year Governor Kelly has proposed Medicaid expansion into her budget. And, in this year, if we expand Medicaid, Kansas would receive an estimate of $370 to $450 million in funding over the next 2 years. This would cover the state's share of the expansion for 8 years. And that number, 150,000 Kansans, right, is always ingrained in our brain when we're talking about Medicaid expansion, would be the estimated to provide affordable health care. In the governor's budget, there's $21 million from state general funds. We would leverage about $610.9 million from federal Medicaid monies. The federal will cover 90% for the expansion. So the expansion in all the budget would create an income for our state general fund. Often you'll hear the talking point SGF. $92.5 million. So this is actually going to bring in revenue that we could use to to fund other things such as special education, right? But the big thing is that this would save our state when all that's all fleshed out. This would save the state if we expanded Medicaid for fiscal year 2024, $71.5 million in SGF funds. And that is a lot of money to me. And that would, if we were to pass that, that would begin in an estimated for January 1st, 2024. If passed, it would enhance the state's federal Medicaid assistance percentage rate to 5%. And this would give access to care to folks who need it, including services like mental health, prescription drugs, ER visits, hospitalizations, and substance use disorders, and more services that folks who are just trying to get by every day need these services, especially in the state that we are with the fentanyl crisis. According to presentations from Kansas Hospital Association that we had in Health and Human Services in the House on January 10th, in September 2022, according to census data, showed more Kansans are uninsured comparison to the United States average. Kansas's uninsured rate is 9.2% in comparison to the United States average of 8.6%. So we're seeing in these presentations, you might see is a term called Medicaid reform. Unfortunately, the partisan of politics I have experienced even as a freshman in Health and Human Services, even saying a peep of Medicaid expansion, the chairperson will automatically get defensive of it and shut down these conversations, which is quite unfortunate when we want to have this discussion. Unfortunately, anytime that is trying to be initiated, it gets shut down immediately. And about 360,000 Kansans are currently on Medicaid, and they make up about 15% of the Kansas hospitals' payers by patient care. And in 2019, Medicaid payments cover about 84% of hospitals' total costs. And so with that being such a charge to hospitals, that is also a burden on the individuals who are on Medicaid, and also a burden on hospitals, because oftentimes Medicaid is not going to cover you 100%, right? So you have to pay out of pocket, and that out of pocket is absolutely ridiculous. So that indebts the hospital, and that indebts you as well. So kind of moving a bit along, I know I got asked to kind of explain the bill process. There's a bajillion ways that a bill can get passed, but the textbook way is it gets introduced either in the House or the Senate side, and then it moves through the process. So either the Speaker of the House or the President of the Senate gets to decide which bill of that committee goes towards. So oftentimes this would probably go through Health and Human Services, and then it would get a hearing. And then afterwards, it would get to be worked in committee, and that's the opportunity that we as legislators can bring amendments. Amendments means any changes to a bill. And we also have some time to consult with our community organizations, our state organizations, to create any amendments or make any compromises during that time. Then you'll also hear a term called work a bill, and that's when we'll offer our amendments and we'll vote if we want this amendment or not. And here in the legislature, a lot of times our votes in committee are voice votes, but each legislator has the opportunity to raise their hand and tell the staff, I want my vote recorded on the record. Now, we don't automatically do that quite yet, so that's probably why when you go on the website, you're like, I wonder how my representative vote. Oftentimes it's a voice vote, but sometimes you might need that roll call vote. So once that, all that is passed out, we'll decide that vote in committee vote, and that's, a voice vote or a roll call vote where we all raise our hands. And then if that passes, it kicks out to the chamber vote when we're all on the floor. So in the House, usually we'll convene at 11 a.m., usually like a Tuesday, Wednesday, or Thursday. And then you'll see another sheet called General Orders. And that, I don't know if anyone has seen that sheet. There's something literally called the line. And so all bills that get kicked out of committee that are ready for all 125 of us to vote is under the line. The person who decides what bills get to be pulled up above the line is the Speaker of the House, which is new. His name is Representative Dan Hawkins. And then once that gets pulled up, that will go through the process through the House chamber, and then that's also another opportunity to add and amend any bills on the floor. And I think that's probably how we have tried to attempt in the past to gut and go some bills that unfortunately failed. And then once that gets voted on, that's where we sit down and press our buttons, and then that gets recorded on record. And if it passes, it will go to the Senate side and repeats that process all over again. And if that comes out the same, we call that a clean bill. If we pass one bill and the other chamber doesn't do anything about it and says this is good, then it goes to the governor, and then they have, I believe, 10 days to sign the bill. If they sign the bill, it goes into law. They can also choose not to sign the bill, and it will just automatically go into law, or they can veto it. Now, if one chamber makes any kind of changes to the bill, it could be technical in nature, adding a period, adding a word, then that bill is technically different than what we passed on the House side, and that will go into a conference committee at the end of session. And you might hear the term conference committee week, and that includes leadership of 2 committees on the House and Senate side. So it would be our chairperson, vice chairperson on the House side, and our ranking Democrat, and on the Senate side, it's the same format, and they would meet and convene and try to make compromises to the bill. And that process gets really complicated and sticky because it's just 6 or 7 people making these decisions about bills, and everything's moving fast, and there's 10 conference committees happening at the same time, and compromise trying to be made. So it's really a hectic week. And if you can be in these meetings, it's always great to see it. But every of our committee meetings are streamed on the kansaslegislature.org website or on the Kansas Legislature YouTube. So you can actually watch from home, and it's archived as well, so you can go back and see other committees as well. So conference committees week is pretty crazy, and oftentimes we might not come to agreement, and sometimes political strategy, they will sub you off of that committee to a representative who will vote yes so we can get this committee out. It gets wild. And so sometimes on a really bad bill, we will vote, maybe as a Democrat, no, and there's something that is called agree to disagree, and it gets pushed out of committee and through the whole process of voting on the House and Senate side. So that is kind of the bare bones of it. There's a lot of political strategies that I'm learning, how bills get passed and how bills get sneaked through. One of the most crazy examples would have to be our tax bill last session, when there was like 28, 25 tax bills that didn't even get a hearing, and we just got in one bill, and they said, vote yes or vote no, which becomes quite difficult when, you might like 10 things, but there's maybe 1 or 2 bad things that if they were separate bills, you would have voted no on. But it's kind of like, if it's for the greater cause, then you'll vote yes. So, yeah. So Representative Branda Landwehr is our Health and Human Services Chair, and Representative Dr. John Epley is the Vice Chair, and our ranking minority, which our Democratic member, is Representative Susan Ruiz. Thank you.
Yeah, I wouldn't propose to stand in for April, but she and I have collaborated on a lot of projects in the past, and I don't know exactly what she was planning to speak to today, but I know there's some things she usually talks about. And some of those have been touched on by other folks on this panel. But one thing to keep in mind is that medical debt is the #1 cause of bankruptcy in the United States. Not just in Kansas and the whole United States, but Medicaid expansion can assist with that. And keeping in mind that uncompensated care, there are like federal uncompensated care funds, but they've all been depleted. Like they're gone. They're long since gone for the most part. And that uncompensated care does lead to scarcity of visits, where the supply of particularly primary care and specialty visits cannot keep up with the demand, particularly in clinics where we're talking about where folks can get care even if they don't have health insurance. It's very hard to keep up with that demand at that point. And then I also just wanted to make sure to sort of illustrate who it is we're talking about. The Affordable Care Act opened up the exchanges. So in Kansas, there is an exchange where you can go online and buy health insurance. And the way that was designed was to be in collaboration, essentially, with also expanding Medicaid based on income levels. So the folks primarily that we're talking about when we talk about these 150,000 Kansans who have been shut out of this process are the people who so if your income limit, the current limit for qualifying for Medicaid is down here. There are subsidies and discounts that you can qualify for through the exchange to buy private health insurance, and it's up here. So the folks we are talking about, and the reason it's up here is that the Affordable Care Act was designed to be in conjunction with making this level here. And so those 150,000 people, a lot of those are people who make just too much, people like I used to be, just too much to qualify for CanCare or Kansas Medicaid, but they make too little to qualify for a discount. They make too little to qualify for the subsidies that would make private health insurance attainable to them through the Affordable Affordable Care Act. So that's who we're talking about. I just wanted to make sure that was clear about when we say Medicaid expansion, who are we talking about expanding it to? It's the people who fall in that gap in between there. So too much for Medicaid, but too little to qualify for a discount through our Kansas exchange.
Too poor for the federal
Yeah.
government program.
Yeah. So I know that's a couple things she usually explains. So.
Thank you. Yeah, thank you very much. And yeah, I'm not sure where April is. I hope she's doing okay. But I have been affiliated with this Alliance for Healthy Kansas, which is April Holman and a few other people that are working hard to promote the idea of Medicaid expansion. They're also working hard to approach the legislators and doing their best to get the word out. They're always talking about covering the gap, and that's what we need to do. We need to find a way to increase the amount of money that can fill in that gap. So at this point, I'm very glad that everybody came today, and appreciate your presence here. We wonder, well, what can we do? Obviously, Christina told us the complicated way that bills are passed. I thought it was just something I learned as a cartoon on Schoolhouse Rock, but it's not like that. But, well, let me just say this, that I think it would be a good idea for the people in the audience who really can't really appeal to our local legislators, because they're all in favor of this, but we know people all across the state, friends and relatives, that could be contacted, and I would encourage you to do that.
Yeah, I just wanted to get extra political for a second when it comes to strategy. So the reason why I asked about Barbara, right? Sometimes when you are trying to do a thing and run an effective, highly targeted campaign, you have to pick the one person with the name and the face that has the power to give you the things that you want. Right? Like for Ty Masterson, he said no on medical marijuana this year. Guess what? He's going to get targeted about that. Barbara Landwehr, being the chairperson of Health and Human Service Committee, that's the office that you need to call. That is who you need to email. And you need to call and call and call and talk to them and email again and again, to the point where you pressure her staff to the point where they're like, look, you're going to have to put something on the agenda because these people are driving me crazy, right? We have had people call in so heavy before that we have ruined the phone system of the Kansas legislature. We have done that. But it took a targeted thing where people all across the state agreed that this day from 9 to noon, we are just gonna hammer away, and we broke the phone system. But we did get our bill in committee and got to at least come give testimony on it, because that's another frustrating thing. Each and every one of us has the right to come give testimony and speak to our legislators about how this will or won't affect us, but you can't even give testimony on it if the chairperson refuses to put it on their committee agenda. So even when we know that Barbara and Ty are going to block Medicaid expansion, keeping things on those committee agendas so that we can hear from Kansans across the state and get more information on how this is affecting people, it can be really powerful. I hope people caught some of the medical marijuana testimony in the special committee that was held last fall and winter. It was amazing to hear from Kansans across the state and what they're going through in regards to that. Same thing with Medicaid expansion. When people come in and talk about how individually it would impact their own family, that is really powerful to people, those personal stories, and it is a key piece in moving legislation forward. So I just wanted to point out Barbara Landwehr, I'll say it again, Brenda, oh, excuse me, thank you, Brenda, thank you, Brenda, who is on record saying some really racist and horrible things. She is just not my favorite person. She is who you want to contact to get Medicaid expansion on the committee agenda so that Christina and other folks there can do some of that work.
And April Holman also encouraged us to write to the leadership, write to the Speaker of the House and the President of the Senate and Vice President, you know, just any which way we can to get this message forward. Are there any questions from the audience now? There's a hand up. Go ahead.
It occurs to me that we're here with Democrats, and for all the things we may be dysfunctional about or disagree on, I do believe Democrats have hearts, and I think they care about people. And this whole panel basically talked about the people who are underserved, can't get service, or causing folks into bankruptcy and all that. Unfortunately, we have to convince some people who aren't Democrats, who don't have hearts, that this is a good thing. And I guess my suggestion is if we don't want to lose again, I think we need to start talking to our medical providers, hospitals and stuff, and there ought to be signs out in front of everyone. If we had Medicare expansion, here's what we could do, because if you had more money, there's more things that our local hospitals could do. If you had more money, there's things, but we haven't talked about that. We've talked about the 150,000. I have Social Security, why should I care? I've got insurance through my union or through, why should I care? Because I think when you start talking about the infrastructure, that needs to be the discussion in Kansas. We have less health care in Kansas for everybody because we haven't expanded Medicare.
Okay, yeah, but I'll pass. So I have a couple of things to say in response to that, and then I'm going to pass the microphone down. So the first thing I would say is that I think we've illustrated by several points that in our legislature, there are literally a handful of people who at the end of the day essentially pull all the strings. And if those people don't want something to make it on the floor, it is completely within their power to not let it get on the floor and get voted for. And this is one of those things, and they don't want it to make it to the floor because they know it's very popular. Whether they believe it would pass in their respective houses or not, they know it is popular amongst Kansans in general. And so they don't want to have that vote record on it. They don't want it there. So, and then the other thing I would speak to, it may not be a billboard outside of a hospital, but when
folks like Americans for Prosperity, and maybe on my side, like Mainstream Coalition, those folks who you see during the campaign season have a lot of influence on how we vote, and they have large followings as well. It could be gone. So they don't want to rely on the federal government, right? This is kind of a common talking point of the GOP, is that we don't want to rely on federal money and funding. And it could be gone, the next day. And they're like, this is not a sustainable solution to our systems. I know if we don't do Medicaid expansion in the right way, it can impact facilitators, hospitals, and community clinics and organizations, patient payments as well is a concern. And the work requirements, such as able body and all that, a common GOP talking point is that we don't want to give assistance to folks who are not working. Looking into more the history of past Medicaid expansion legislation, I believe Governor Kelly was for folks who are asking to be on Medicaid to help them assist with job hunting, but folks on the other side of the aisle wanted them to really be referred to jobs and see that connection towards. And then of course, having abortion to be on, to strip abortion rights away in the Medicaid expansion bills. So these are some of the talking points that I hear, and that can help frame your messaging and disinformation that unfortunately my colleagues believe. I really would like to see the mobilization. I know COVID has really impacted our ability to rally and protest in the past 2 years, but I would love to see the mobilization, Capitol Days, rallies, I'd say get angry, or if you want to lead with compassion, fiery energy. and make this present, make this be loud again. And I like that comment that, we need to, this is obviously an overwhelming favorite policy of both sides of the aisle, of all Kansans, of Kansans who don't even vote, of Kansans of all political spectrum. So we really need to hone in on that. And maybe, I'm not too sure, can we pull from the playbook of how we got August 2nd to fail? Really bring it down to the core and to the bare bones of why this is all good for all Kansans, from Western Kansans to Eastern Kansans, and to the future of our state.
Whatever comments they want to make. I know we're running a little bit over, but if we have other.
Is there any fundraising initiatives like with the LMH Foundation or Heartland or anything like that that you can share? Well, or just in general, because we've been at Expand Medicaid, you're having to raise money or.
Yeah, I think the question was whether or not Heartland or LMH Health are engaging in any fundraising activities because we don't have Medicaid expansion. So one thing I would mention is that Heartland does have a compassionate care fund that specifically assists patients when they cannot afford to pay for the cost of their treatment or care at Heartland. That is set up through the Douglas County Community Foundation, or you can give directly to Heartland through our website. And so that is something that we are actively doing to help us offset the costs that are associated with providing care to uninsured patients at that discounted fee schedule.
And LMH also has the Help and Healthy Fund, and people can donate to that. We also partner with University of Kansas for a medical legal partnership. So individuals who are having difficulties with a landlord or just getting paperwork, simply getting a driver's license can be difficult for some individuals, so we do a lot of work with the population on that as well. So it does cause us to be creative.
Okay, well, we're running over, and I appreciate your attention, and I really want to thank our speakers today, and just have one more thing to say. Go Chiefs and go Hawks.